Good morning to you and to all those who tune in every morning. Like yesterday, we're beginning by the most difficult part of this briefing, which is giving our condolences to the relatives, to all the family members, friends, and co-workers of 3 persons who died yesterday to COVID-19. We are referring to an 84-year-old female patient from Plaza municipality in Havana. For several days, she was reported in critical condition. She had a history of high blood pressure, cardiac insufficiency, and on April 14 she was admitted and had spent 11 days at the intensive care unit. She died at the Salvador Allende Hospital here in Havana after several complications such as a natural ventricular block, a sepsis event that led to a respiratory and cardiac arrest. And here I would like to stress that for our health professionals taking care of these patients, these deaths are like a defeat. But at times, complications arise from pathologies that are very difficult to manage. But we must bear in mind that from the very moment they are admitted to our hospitals, there is a battle to save the patients' lives. The second deceased person is a 77-year-old patient from the province of Matanzas, reported in serious condition with a history of high blood pressure, cardiac insufficiency, diabetes mellitus, chronic renal insufficiency, requiring hemodialysis treatment, a group of conditions that contribute to an unfavorable evolution. She had been admitted to the Matanzas Military Hospital, where she died at the intensive care unit. This patient, at some point, she showed some improvement, and she even started with sessions of hemodialysis, but regrettably, she passed away yesterday. The third person is a 73-year-old patient. He was HIV positive. He had been admitted to the Salvador Allende Hospital. He had a very torpid evolution, and in a short period of time, after spending some time at the intensive care unit, he passed away. So we would like to reiterate our condolences to the relatives and friends of these people, which is definitely the most difficult part of this briefing. With these 3 deceased, we now have a death toll of 54 as a result of this disease. Let me now turn to the situation in our country regarding the presence of the disease. We also have to inform you today that we have 6 patients in critical condition. 3 are in the 50 to 59 age group, 1 in the group of 70 to 79, and 2 in the group of 80 to 89 years of age. As we have said, these are high-risk ages. We also have to report 6 patients in serious condition, 1 in the group of 40 to 49 years, 2 in the group of 50 to 59 years, one in the 60 to 69 year, one in the 70 to 79 year group, and one in the 80 to 89 years. These are the age groups of these patients. Turning now to the situation in our country, 6,759 Cubans who reside abroad are on the island, and 4,784 foreigners, for a total of 11,543 visitors. There aren't much changes on the number of foreigners staying in rental houses and in the municipalities where they are, which we reiterate here every day. In our hospitals, a total of 3,461 patients have been admitted. 57 patients are under surveillance, 2,592 are suspected cases, and 812 are confirmed cases. At the primary healthcare, we have 5,876 people under observation. These are people who have been exposed to certain risks, and these even include patients who have been discharged from hospitals who spend 2 more weeks under observation. Yesterday, our laboratories processed 1,837 samples for the detection of COVID-19, of which 829 were at the laboratory of the Pedro Curie Tropical Medicine Institute, 349 at the Provincial Center of Epidemiology and Hygiene from Villa Clara, in Santiago de Cuba laboratory 283, 252 samples at the Provincial Laboratory in Havana, in the Havana Civil Defense Laboratory 3 samples, in the Genetic Engineering and Biotechnology Center 67, and at the Molecular Biology Lab from the Brothers Jaime Heiras Hospital 121. As a result of the study, 32 patients were diagnosed with SARS-CoV-2. This represents the 1.74% of the study samples, lower than yesterday. Cuba already has conducted the study of 39,828 samples, and 1,369 have tested positive to SARS-CoV-2. This represents the 3.4% of the processed samples. Of the 32 new cases confirmed, all were Cubans. 28, that is 87.5%, were contacts of confirmed cases, and in 4, 12.5%, the source of infection could not be established. On this particular subject of the asymptomatic cases, I would like to reiterate the need of people, when asked, they should contribute, they should disclose the largest number of people that they have been in contact with, because this is a high-risk group of people which our health system needs to observe to detect or discard that its members have the disease. 22 of the new 32 cases were female, that is 68.7%, and 37.5%, that is 12 of the 32, were asymptomatic. These are the people we look for in the high-risk groups. The age group with the most cases is the one from 40 to 60 years of age, with 16 cases, 50%, followed by the age group of 20 to 39 years with 12 cases, which is the 37.5%, and the group of over 60 years of age with 4 cases, which is 12.5%. The province of Havana has the most cases with 18 cases, that is 56.2%, and Matanzas with 7 cases with 21.8%. And here I would like to comment on the positive rate by provinces, which is estimated per every 100,000 inhabitants. We know that taking into consideration the number of cases reported by the special municipality of the Isle of Youth, it is reiterated that this is the territory with the highest positive rate in the country. However, Havana, which used to be in the fourth and third place, it is currently on the second place with 20.6% rate per 100,000 inhabitants. Villa Clara follows with 24.3, Ciego de Ávila with 18.7, Matanzas with 13.2, Santi Espiritus with 12.9, Mayabeque with 11.7, Pinar del Rio 8.2, Holguín 7.7, and Artemisa with 5.2%. These are the provinces with a positive rate higher than 5%. With respect to the international situation, our population is well informed through the media. What we can do is to reiterate that this disease continues spreading despite the measures that have been implemented. 182 countries remain with the presence of COVID-19, with a cumulative total of 2,744,744 confirmed cases, almost reaching the 3 million mark. 76,609 new cases were confirmed in a single day, and what is worse, 5,151 people died, for a total of 195,387 deaths, for a lethality of 7.12%. The region of the Americas reports 1,072,680 confirmed cases, 30,155 more than yesterday, and the cases of the region account for 39.07% of the total number of cases in the world, with cumulative total of fatalities of 60,752 fatalities, 1,835 more deaths, for a lethality of 5.66, higher than yesterday. So, this is a summary of the national and international situation regarding the COVID-19 pandemic.